Welcome to Coffee with the County. Today I'm with Ivan Bartha, a public health educator for our Health and Human Services department here in Aitkin County, and one of our newest members of the Aitkin County organization. So welcome, Ivan.
Thanks, Mark. I appreciate it.
Yeah, it's great to have you here. You're fresh into a couple of weeks of activity.
Yeah, starting week number 4.
Wow, look at you, seasoned veteran already.
I wouldn't go so far as that yet, but I'm getting there.
That's great. So tell me a little bit. Let's start with you first. How'd you find Aitkin County? What's the history there?
Well, so my background is in outdoor recreation, education, leadership, risk management, and one of the areas that's always been adjacent to what I do has been public health, health promotion. It's what we do. We're protecting people, and it can look like a lot of different things in an outdoor leadership setting. But when I came to Minnesota in 2005 to run the Outdoor Endeavors program at St. Cloud State, one of the people that I started working with initially was our health promotions person on campus, who was a public health educator by trade.
Yeah.
And so a lot of our events that we did on campus, while outdoor focused, really fit in well with what Troy did in his role. So there was a lot of collaboration going on there. So for, virtually 14 years, every time we had some sort of program that focused on health, well-being, safety, it was always kind of in partnership with our health promotion staff on campus. And then the other person was the person who was our health, wellness, and fitness coordinator. It just made sense. And then there were some transitions that happened in life, much like life happens. I stumbled across the posting. There were a lot of things that ticked. I have some colleagues that work in the community. One particularly who I sent the posting to, and he very strongly said, you need to apply for that job. You need to consider what you could do to help. Help is a wrong word. Enhance, support, and provide services to the people living in Aitkin County. So it was a kind of one of those weird alignments of the planets. And here I am today in your office.
It's interesting. Little did you know you were training for it a long time ago, and everything comes together.
If you think about the big things that we've experienced in the last, decade, trying to run a canoe expedition with college-age students during an era of COVID became very complicated because we're living, eating, and breathing in arguably the safest environment out there, yet we still had to maintain some level of protocol so that people stayed safe. But yeah, I always use the term adjacent because outdoor leadership and outdoor recreation. A lot of what we do is sort of that first, second cousin to public health.
Certainly.
Yeah.
So now as your public health here, main responsibilities that you would have as a public health educator, tell us a little bit about what's in your head after week 4. You've got it all figured out.
Well, I can tell you this, that a big part of my job is emergency preparedness in the county, and I take that very seriously, largely because, again, coming from where I came from, risk management is a core function of everything that we did. We want everybody to get returned to their loved ones with the same number of toes and fingers that they started with. And so because we live in central Minnesota, we have a lot of things here that we need to kind of be dialed into. Again, obviously with the weather, winter weather safety and preparedness, it's a big deal right now. It's cold. My heart goes out to the people that are battling with frozen pipes and cars that won't start. And it's a public health issue. And I would say the same thing in the springtime when we get into severe weather season. So that's a big chunk of my job.
Our demographics of being on the older side, a lot of our people out there have retired and have moved here and done different things, and so it's a real concern, right, of making sure that our elderly folks or our people that are getting up there and retired are being taken care of and being watched out for.
Yeah, and I think just the rural nature of where we live, trying to explain this to somebody that doesn't live in rural Minnesota. So think about it from that lens. My dad down in Florida, who's never lived in a rural location, he's always been in pretty urban urban areas. So trying to explain to him that, Dad, think about it this way. Everything is between 30 and 60 minutes away from each other. So now just our simple geography poses its own challenge in emergency response time, preparedness, and then also because our communities are so widely distributed that even then we have to consider sort of those really like micro local sort of things that are going on in different communities. So yeah, that's a big chunk of my job, quite a bit with mental health and
Good.
really supporting our community with resources and opportunities to engage, destigmatize, support what we're doing, not only as a Health and Human Services department, but also our local partners as well. So one of the groups I oversee is the Committee for Awareness and Prevention of Suicide, the CAPS group.
The CAPS group, yeah.
Yeah, and so the CAPS group is largely responsible for the Stay, Run, Walk rally event during Riverboat Days. I'm excited about that because as an event management guy, I see opportunities to make things better and to tune things up a little bit. So I've already been working with that group to kind of get that subcommittee going. We will again continue to do the senior wellness yard signs for the students that are graduating. So that'll be another piece of the puzzle. And then again, just, a lot related to communications, like what information is getting out there and is it the best information, and can we package it up in a way that the community is responsive to it. There's been a lot of changes in guidance regarding childhood immunizations, the changes in sort of how we look at food.
Yep.
And then obviously from my sort of lens is I want to make sure that my colleagues are supported as well, that we have it's sort of the perfect Venn diagram that, if we all overlap, sure, it's redundant, but everybody's covered, and that's the big thing I think that I'm seeing is just making sure all our bases are covered in the county when it comes to some of these things.
I've been lucky enough to be invited to work with Erin and her group. Erin invites me in, which is cool. But Hannah, all those over there have been great to work with, and I look forward to working with you.
They're really an outstanding bunch. I feel super fortunate that I've fallen in a situation with an incredibly talented, smart, dialed-in group of coworkers. I think isn't that our goal in life, is to surround yourself with people that are way smarter than you?
That's right.
So right. I think there's a lot of value in that for me. And it certainly helped me understand all of these bits and bobs of public health that are kind of next level, knowledge.
Well, I'm looking forward to working with you. I'm looking forward to having you stop back in on us on occasion and tell us what's happening with the different things and give us a perspective after 4 weeks in. Tell us what happens in 3 months. Well, I think,
we had that conversation earlier, and, again, a healthy community is a prosperous community, and I don't think that, we understand that, and we want people to be happy, healthy, and whole, and everybody wins. Yeah. And I think that's I'm very passionate about that.
Ivan, thank you for coming in.
Thanks, Mark.
Yeah, it was great to meet with you, and we'll talk again soon.
Sounds good. Have a great day.
Yeah, you too. Ivan Bartha, our public health educator out of HHS, one of our newest employees here, and very talented and very passionate about the work, and can't wait to see everything that gets done out there for him and by him. That's it for today. You're listening to Coffee with the County.